Hi guys. I actually am not the tooth fairy. You know, the tooth fairy is only this big, and he's a boy, so I just work for him. Anyway, I know many of you have seen my presentation already, so I'm doing something different today, and it's a little scary, but I thought maybe it would be interesting for you to know a little bit about the organization that I work for. So, okay, let's see if this. It's on. No. So it's all about children's oral health, and you all know that it is the most common chronic disease for kids in our country. Lots of people don't know that. They go, oh, I didn't know that. It affects 59% of our kids, and it's 5 times more common than asthma. Did you know that? Yeah, you all knew that. And it is. It has an impact on kids' lives, and I'm sort of in education too because I'm on the school board, and the impact on education shocks me, and I think that we all need to know how much kids are missing school because of dental disease. So 51 million hours of school are missed each year, and then their parents have to be out. That's an economic issue as well. In North Carolina, kids with poor oral health were 3 times more likely to miss school, and kids with poor with recent toothaches were 4 times more likely to have lower GPAs. I think that's pretty significant. 30% of parents indicate that their children are missing school due to an oral health problem, and 1 in 7 children ages 6 to 12 have suffered a toothache in the previous 6 months. So in 2006, this group of underwriters came together to form the National Children's Oral Health Foundation. It was after the death of Diamante Driver, you all know that story, that they decided we really need to do something about kids' oral health, and we're willing to put some money into it. It's been directed by, it really was formed by a woman named Fern Ingber. Many of you know her. She was like a dynamo. You were not going to deny her. She got what she wanted, and she did that for 10 years. And we have a new executive director now. But this is our board of directors. And 3M has been a big supporter of the ToothFairy, and right now Jim Ingebrand is the chair of the board. He's a 3M oral health care guy, and Tom Ingalls is also on the board. He is retired now from 3M, and a great supporter of the program. We also we've partnered with a whole bunch of people nationally to support their work and integrate oral health into the programming that they do too. I think some of the big ones are HOSA and Girl Scouts. Some of our Girl Scout troops are doing amazing work in promoting oral health. So here's our mission. As we are a resource provider, and many of you know that, we increase access to care by supporting nonprofit clinics and community partners in delivering education, prevention, treatment services for kids. And since 2006, we've improved millions of little lives. So again, the goals are really to increase access and to improve oral health literacy and practices of positive oral health. So that prevention piece that's so hard to measure sometimes is what we do. We support, that sort of is redundant, isn't it? I should take that out. So we support a network of nonprofit and safety net clinics around the country, including about 20 in Minnesota. And then we have this In the Gap program, which is new now, that allows for 1 child a month to get a sort of a grant. So it comes through our clinics that are in the network, and a child that needs some extensive dental work can get a grant to get that paid for. So I guess we're getting 12 more kids every year getting services. In those clinics, we also are providing some financial support. So clinics who are members of our dental resource program there's sort of two levels. One where they can get our materials, and then they're able to apply for grants, generally around $5,000 to do more outreach and education. But then the next level has that opportunity as well, but they also get free stuff. We have a number of those underwriters who are dental vendors provide products that are soon to expire or that didn't sell, and they give them to us free, and we distribute them, and some of you get some of that stuff, and it just helps the bottom line, right? So we can serve more kids. So it is in Minnesota. We have about 20 clinics. I have a list for you, but they've received over $110,000 in grants over the last few years, and last year $154,000 in products. So you see, it can help. Here are our clinics. There are 20 of them right now, and there's some I want yet on this list, and I keep bugging them. You'd think I was really a good arm twister, but I haven't gotten there all of them yet. So the ways we raise money, we've got those corporate underwriters, but we also do a ToothFairy ball every year, and you probably got emails about it. It's a virtual ball. You don't have to get dressed up and all that stuff, you know. It's just really a donation. And so the money that's raised in Minnesota from the ToothFairy ball stays in Minnesota. And Tom Ingalls donated enough to provide a grant in his name. So this is just an example of what some of those grants can do. So in Medelia, in the school, they are able to do more, and they integrated more into their curriculum, more oral health, and they've done fluoride treatments in the schools. So we serve a lot of kids in those nonprofit clinics in Minnesota. We ask for a report every year, and last year over 5,000 kids were served in our dental resource provider clinics. So then we do education, and you guys probably have all seen our stuff there. It's on the table back there. It's a great little education kit that has 12 lessons that ranges from prenatal all the way to age 18. They're all free, which is I have the best job in the whole wide world because I can just give people stuff and it's good stuff. It works. It's easy to use. The kids like it. Adults like it. It's pretty cool. And we make it available to anybody who serves kids. And also, we have a lot of university partners. Lots of you are university people who have used it and are out there doing good work with it. We also do smile drives every year. I'll tell you a little bit more about those later, but that's another way that we're raising awareness and getting products into the hands of kids. So here are some of our community partners. We have 130 that I have on my list, and I think I've talked to people today who said we're using your stuff and I don't have them on my list. So there's a lot more than 130 agencies in Minnesota who are using ToothFairy materials. But these are just some of the programs. I didn't put libraries on there, but in St. Paul the libraries are using our materials in their story hours, and then they've built a learning center that they put in the library. They sort of rotated around the community. But Head Start programs, child and teen checkup clinics, child care programs, ECFE, school-based programs. Anybody who has contact with kids can integrate these materials. Here are some of our university partners. These folks get kind of what they need. Joanna's rural, in the dental school, the rural outreach program took a whole bunch of our kids out and used them all around Minnesota last summer, the summer maybe both summers, 2 summers. Whoa, time flies. But they find them really useful. They don't have to create their own curriculum. It's beautiful. They just take them and use them. And then we have opportunities for kids to get a note from the ToothFairy every 3 months or so. There are cards back there if you want to. I tell adults to sign up too, because there are ideas for tips on how you care for your teeth and reminders, and they're fun, and you can print them, reproduce them, and use them in your practice. So one of the things that is one of the programs is the oral health zones, and in Minnesota we're lucky to have an oral health zone. There are only two others, one in Orange County and one in Arkansas right now, and then Minnesota, and the whole state is covered. It is really just a comprehensive community-based approach. So I get to work with communities. I get to work with anybody who's working with kids. You heard Sue talk about some of the work we've done with Dakota County, but we've worked with already 6 different communities. In Ramsey County, we worked mostly in the Karen community, got to churches and some of the leaders in that new immigrant community, and did a lot of education. You can see in the picture that Ramsey County has a couple of Karen staff people, which is great because they had the inroads and they had the language to be able to work with folks. In Olmsted County, we did a year's worth of work around raising awareness in the community, trying to get a little more fluoride varnish applied in pediatric clinics, and that group is still going and going strong. At the Brian Coyle Center, I got to work with 14 Somali youth, and we trained them on oral health, and then they did some extra education at the center. There they are. I kind of stand out, don't I, in that picture? I don't know how white I was. And now we're working in Northwest Hennepin with the Family Collaborative. We've done some health fairs. We're working with the schools there and some of the clinics. You heard about Dakota County. In the Promise neighborhood in St. Paul, we're doing daily toothbrushing in a bunch of the classrooms there. We have 2 schools that have 4 classrooms that are brushing teeth every day. I gave them the stuff, and we're doing education, and the kids are loving it, and the teachers are liking those sweet-smelling mouths. And then in the St. Paul, well, I have a little influence in St. Paul because I sit on the school board, so they like to suck up a little bit, and I might as well use it, right? So their summer school used the materials in all their kindergarten and first grade classrooms. They made posters, they used the curriculum, and they brushed teeth every day. And I think we're going to gather some data to see if their attendance is better in those schools, because those summer school kids are kids with the most challenges and the most vulnerable. So we'll see. Next year I'll report. Okay. And then we do these smile drives that are fun and kind of a great way to raise awareness. And we're bugging people right now to get some planned. And so if any of you are interested, I have to get 10 smile drives this year. But they're just like food drives. It's a way of gathering of toothbrushes, toothpaste, mouth rinse, floss, and then raising awareness and sort of engaging the whole community and making sure our kids have what they need to care for their teeth. So we provide all the materials for that. If you're interested, really, you can talk to me, or you can go to the website. Everything's there. So there's point of sale displays, there's flyers to use for promoting it, and other ideas for how to gather up materials. And and then at the end, the products are given to a charity or a child-serving organization in your community. So whoever gathers the materials decides where it goes, and then you can go and get the press there and all that stuff. And there's just a little bit of different avenue for raising awareness around kids' oral health. In Charlotte, they collected 30,000 toothbrushes. The police department collected 30,000. I think they collected over 53,000 products, and now kids in Charlotte have toothbrushes. And so this is all because of Delta Dental. I didn't tell you the origins. So there was a group from the coalition that really encouraged National Children's Oral Health Foundation to write a grant to Delta Dental for the oral health zone in Minnesota. So without the Delta Dental Foundation in Minnesota, or of Minnesota Foundation, we wouldn't be here. So grateful for their support.